Bill Shelton was diagnosed with rheumatoid arthritis about 10 years ago.
My joints would hurt, they would ache, I'd get swelling in my wrists, in my hands, my fingers will swell.
To treat his RA, every 60 days, Bill receives anti-TNF medication through an intravenous infusion.
These are therapies that are very specific in terms of inhibiting a specific component of the immune system.
Inhibiting the immune system to help treat diseases like rheumatoid arthritis can also leave many patients vulnerable to infections.
One of the most important infections for people with rheumatoid arthritis, for example, is herpes zoster reactivation, or shingles. Patients with RA are 1.5 or 2 times at higher risk for shingles than patients not with RA.
Dr. Kevin Winthrop from the Oregon Health and Science University and co-authors studied patients who began anti-TNF therapy and evaluated whether using this therapy was associated with an increased risk of developing shingles. Researchers compared these patients to those who used other therapies.
The patients who started the anti-TNF drugs were at no higher risk for developing shingles than the patients who started the non-biologic drugs.
The study appears in JAMA, Journal of the American Medical Association.
We found an increased risk of shingles in patients using prednisone, and that risk increases with higher doses of prednisone.
Researchers point out that a shingles vaccine is available in the United States. The high rate of shingles in the study population supports vaccinating older patients with rheumatoid arthritis. Bill says the medication he receives has really made a difference.
I'm sleeping well, the pain level is very much under control, life is much better now.
Catherine Dolf, the JAMA Report.